Hi there. If you wanted to learn more about hormones because you're not sure if they're responsible for your health concerns, you're in luck. Over the next 4 weeks, we'll be discussing one hormone every week in order to help create a better understanding for you as to what healthy hormone balance could look like. My name is Dr. Depalang, and I'm a naturopathic doctor. And today we're going to start with estrogen. So estrogen is an important hormone that is made by the ovaries for the most part. And the job of, there's several jobs of estrogen, but the one I'll just focus on is helping to maintain a healthy menstrual cycle. So very important to have normally increasing estrogen levels during the first half of the cycle. That's before ovulation. And then after ovulation, estrogen should come down nice and low. And we want to see that every monthly cycle for as long as we're having our periods. But sometimes you can get too much estrogen and sometimes you can have too little estrogen, and both can lead to symptoms that women experience at different times of the month. So we'll start with estrogen excess. This is commonly seen as heavy periods, irregular periods, even anxiety, PMS, irritability, and weight gain, especially around the hips and waist. These could all be indications that maybe estrogen's a little bit too high for you. And this can often happen, especially the heavy and irregular periods, in conditions like endometriosis, fibroids, and even polycystic ovarian syndrome. Now, in the case of estrogen deficiency, now we're looking at conditions like dryness of the skin and the hair, vaginal dryness, hot flashes. You can see these are very important, especially when we get into the perimenopausal years. But also in terms of fertility, as I mentioned, it's important for thickness of the uterine lining. So if there are fertility issues, we definitely want to make sure that there's no estrogen issues, especially going on with the thin lining. Also, both estrogen excess and deficiency can be linked to fertility issues and also have other overlapping symptoms, including decreased sex drive and mood swings. So both of these are very important. And as you can see, the only way to tell really if you're going to have high or low estrogen is to measure it. So testing through the blood is a really good place to start. That can tell us what the estrogen levels are like in the blood, but it doesn't really tell us how much is getting to the actual tissues. And if we want to look at that, then we want to look more into salivary testing. So both of these testing have its merits, and they're both used, and I've used them both in my practice as necessary. So what do we do after we find out too high or too low estrogen? Well, we want to do as many natural things as we can to help bring this into balance. So I've spoken about estrogen dominance, so excess estrogen, in previous videos that I've done, so I'll definitely put links up to that for our detox for hormonal balance, and even for our fertility series. I mentioned that, so I'll put some links to that if you want to learn more about that. And in terms of estrogen deficiency, it can be a little bit more challenging because there we're looking at raising estrogen, and there are definitely herbs and supplements that might be able to help. And in some cases, we might even need to do bioidentical hormone therapy using natural forms of estrogen. So all of these are possible, and I just wanted to introduce some of these ideas so that you can start to check in with yourselves and consider this, because there are lots of treatments that you can do for yourself so that you don't have to suffer with these symptoms in silence. So that's all for estrogen. Remember that it might not even be estrogen, but also a combination of different hormones like the ones we're going to talk about in the upcoming weeks, because hormone balance, all of these hormones are really linked together in the way that they're made, and when one goes up, another might go down or up, depending on what hormone it is. So because of that fine balance, we really want to know what all of these hormones are doing all together. All right, stay tuned next week when we'll be talking about a hormone that's very important for blood sugar regulation. Take care until then. Bye.